How's it going, guys? We have a very easy question for neuro for step 1/2. You can just see a 1-2 liner here. What's the diagnosis? So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. Really appreciate it. Find me on Instagram at Mehlman_medical, MEHLMAN_medical. Links down below. Find me on Telegram. Recently created Telegram group and channel. Links are down below. Now let's start the clip. 51-year-old woman comes to the physician for a 4-month history of generalized muscle cramping. Examination shows a left foot drop, fasciculations, muscle atrophy. Reflexes are brisk. Sensory examination shows no abnormalities. Question just wants to know the most likely diagnosis. So let's just walk through the answer choices here. We'll go backwards. Choice E, subacute combined degeneration. Wrong fucking answer. It's just a fancy phrase that refers to the neurologic degeneration seen in vitamin B12 deficiency. Okay, so resources, including my own. We'll mention that subacute combined degeneration is loss of the dorsal columns, spinocerebellar tracts, corticospinal tracts. We'll mention that triad so that you as the student have a bit of context to grab onto. So you say, okay, that's what subacute combined degeneration is. It's due to vitamin B12 deficiency. USMLE doesn't really give a fuck, okay? They just want you to be able to identify B12 deficiency in a vignette, a vegan, pernicious anemia, let's say, there's neurologic dysfunction, and then the answer is just B12 deficiency, or the answer is just subacute combined degeneration. I've only seen this once as a correct answer on one of the 2CK neuroforms, okay? It's usually just you need to be aware that B12 deficiency can cause neurologic dysfunction. Choice D, neuromyelitis optica, also known as Devic syndrome, DEVIC syndrome. Wrong fucking answer. However, this is asked once as a correct answer on 2CK Clinical Mastery Series Neuroform 6, I believe it is. Now look, this vignette is going to present similarly to multiple sclerosis. So you're going to read the vignette, you're going to say, okay, sounds like MS, but then they're going to tell you IgG oligoclonal bands in the CSF are notably negative. And then the answer is just antibodies against aquaporin 4. Absolute fucking nonsense, okay? Absolute horseshit. Not my fucking opinion. As I just said, it's on the Clinical Mastery Series Form 6 for neuro, which means it's assessed on 2CK at the minimum. Wrong fucking answer. Choice C, myotonic dystrophy. Wrong answer. This is going to present as a patient who's unable to relax muscles, okay? So classic buzzy descriptions such as patient shakes someone's hand, can't let go of the golf club, okay? Can't let go of the doorknob. That's what myotonia is. This is one of the trinucleotide repeat disorders, CTG, repeat. That detail is actually low yield. You just need to know the presentation as I described. That's the high yield point for myotonic dystrophy. Choice B, Charcot-Marie tooth disease. Wrong fucking answer. This is also known as hereditary motor sensory neuropathy. I've seen this as one correct answer on one of the 2CK forms. All you need to know, because we're cutting to the fucking chase, right? All you need to know is that this is an obscure neurologic disorder, and if they give it to you on your USMLE, they're going to tell you the patient has quote-unquote hammer toes, okay, which are toes that are always curled in, and also high arched feet, pes cavus, okay? So if they give you, so this is the deal. You're going to get a question, some obscure neurologic issue. You say, no idea what this fucking is, but they're going to tell you patient has hammer toes and high arched feet. And you just say, okay, well, that's Charcot-Marie tooth disease. Okay, that's simple. Correct answer is amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig disease. You need to know there's 2 requirements for ALS as the diagnosis in a USMLE vignette. The first is the combination of UMN and LMN findings, upper motor neuron, lower motor neuron findings, okay? So, and the second is absence of sensory abnormalities. So you can see here, foot drop, fasciculations, muscle atrophy, these are all lower motor neuron findings. Brisk reflexes, these are upper motor neuron findings, okay? And they can also mention Babinski reflex, okay? That's upper motor neuron. Clonus is upper motor neuron. If they tell you increased muscle tone, that's upper motor neuron, okay? But muscle atrophy, weakness, classically lower motor neuron. So you also need to know creatine kinase can be elevated due to increased muscle tone. But this no sensory abnormalities, very fucking important. Because if you get a harder ALS question, let's say they give you a big fucking paragraph, you're not sure what it is, you see ALS as one of the answer choices, and then you see somewhere in the vignette that there's sensory abnormalities, you can say, okay, cool, not ALS. All right. So high yield diagnosis, combination of a UMN and LMN finding. That's your first requirement. The second is no sensory abnormalities. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.